moving on, Unit 2. We're going to look at a whole bunch of drugs that affect the nervous system. And keep in mind that what ATI says on page 84 is that you're looking at adverse effects, contraindications, side effects, what you want as your outcome, and how you're going to administer it safely. So let's go first with anxiety disorders. Benzodiazepines are huge. Diazepam can be used not only as anti-anxiety, but remember, I think this might have been on your exam today, that benzodiazepine of diazepam or lorazepam, if your patient comes into the emergency room, status epilepticus, that's the drug you're going to give to stop the seizure. You're not going to give a seizure drug, but that benzodiazepine is the emergency treatment for seizures. It stops the seizure. So keep that in mind as you go forward, that benzodiazepine can be a two-sided drug. So you have your typical benzodiazepines, and of course you have a couple SSRIs, that sort of thing as you go forward, and other antidepressants. So let's do the greatest hits. What are the side effects? Remember, these patients that are on any of these medications are fall risks. So sedation, lightheadedness, decreased cognitive function. These are the drugs that you don't want patients driving heavy machinery, right? Okay, so that's the type of thing we want to think about is how are we going to keep these patients safe, and how we're going to decrease their anxiety but not over-medicate them. We don't want to do what some nurses call snow them. We want to make sure that they're using this drug appropriately. And remember that many of the drugs here are controlled substances. So side effects are really important to monitor because we don't want to snow patients. All right, so moving on to our next chapter. Just looking here. If there's something I missed in anxiety disorders, I think we're good to go. So Chapter 8 is next. Chapter 8, nervous system or depression. Keep in mind, again, safety, safety, safety. Remember, main depressive drugs, antidepressants, take weeks for them to settle in. But as the patient starts feeling better after starting the medication, remember, we're implementing suicide precautions because these patients, once they get more energy, they're more likely to attempt suicide. So that's the double-edged sword with these medicines. We're going to start it. It takes several weeks to get to a therapeutic range, but halfway between, they're not feeling too great, but they feel they have enough energy that they're going to try to kill themselves. So we want to make sure that we watch them for those types of side effects as we go forward. Now, remember, too, with these drugs, you have your anticholinergic, you have your sedation, you have all that sort of stuff that's important to watch out for. So keep that in mind. And, of course, we already talked about MAOIs and tyramine. One of the interesting things to keep in mind, too, is never forget about sex for your patient. And so an issue with these drugs is that whole sexual dysfunction with no orgasms, impotence, decreased libido, and adding into their weight gain. That's not sexual performance, but it also affects your sexual life as well. So weight loss might be early. Your book says weight loss might be early in therapy, but the gain is after long term. Serotonin syndrome is 2 to 72 hours, so sometimes that can be in effect. So as I move on, there's orthostatic hypotension. Remember, there's the greatest hits of many of these drugs, and what your goal is, antidepressants. There's what happens with all antidepressants, but then you know for specific ones, there's specific things you need to keep in mind. MAOI, tyramine, right? Okay. So, again, toggling down. Oh, good, I can use that. Toggling down, you see atypical things. Remember that some of these drugs can also be used for other things. And so, key thing to keep in mind is when you go into your patient's room, this is part of that assessment and health history piece, know what you're trying to achieve. Gabapentin can be a seizure medicine, or it can be used for pain. If you go into a patient's room and you say, I have your seizure medication, and the patient says, I don't have seizures, I'm not taking that med, well, really, it's for their peripheral neuropathy. So you, as the nurse, need to know what specifically you're giving that drug for, because some of these drugs do have the cross. When you get the peds, you're at Lurie's, you're going to be giving some of those erectile dysfunction drugs to kids. And it's not because they need an erection, it's because they need better perfusion to their heart. So those types of things are the intuitive things that are important. Real quickly, I'm going to do Chapter 9 and then do another video. Bipolar disorders. There's the classic ones, and today there was lamotrigine on your exam, perhaps, I'm not sure. But remember, lamotrigine can be used for bipolar, but also it can be used for seizures. And so depending, I have two friends that I know, and they both take lamotrigine. One's an epileptic, but the other one is bipolar. They kind of laughed and were curious until I educated them, well, this is why. So keep in mind that there are multiple uses for drugs, and it's just knowing what happens with these drugs. Remember that with your medications that are seizure, I'm sorry, we're talking bipolar, but remember that you can have toxicity too. So like with lithium, we're going to watch for lithium toxicity and know that sometimes we need to monitor the lithium levels. On page 112 it talks about that, until you get to a therapeutic area. And if you have a patient come in and you suspect toxicity, you're going to draw that, because lithium can get to a toxic area. All right, so bipolar, there's lots of different drugs that are used there, but just keep in mind that they can be toxic on occasion, and you watch for things such as blood dyscrasias. So I'm going to stop this video, and then I'm going to do the rest of Unit 2.